Hello and welcome. This is Dr. Raja and I'm back to you guys with another video, and today we'll be starting blood malignancies. So before starting blood malignancies, you should know about the paraproteinemias. There's a term known as paraproteinemias. Okay, never mind. This is paraproteinemia. So paraproteinemia is like a group of disorders which is characterized by high circulating level of immunoglobulins. So paraproteinemia is a group of disorder which is characterized by increase and high circulating level of immunoglobulins in the circulation. So this is paraproteinemia, and there are many disorders, like 6 of them. So first of all, we will start the first one, and that is multiple myeloma. So we have got the concept that what happens in this kind of blood malignancies is that there will be increase or high level of immunoglobulins in our blood. So the first malignancy we will start is multiple myeloma. So multiple myeloma, okay, let me just give you the definition. It is a neoplastic proliferation of monoclonal plasma cell that will lead to abnormally increased circulating level of these monoclonal, I will just write MABs, like monoclonal antibodies. So this neoplastic proliferation of monoclonal plasma cell will lead to abnormally high circulating level of monoclonal antibodies, which would further lead to multi-organ failure. So these are the points that you need to remember regarding the multiple myeloma, that is gonna affect the monoclonal plasma cell, and there will be raised level of monoclonal antibodies, which would further lead to multi-organ failure. These are the key points that you need to remember regarding multiple myeloma. So what happens in multiple myeloma is, whenever there's an infection in a patient, mostly in a baby, so the antigen from the infection will present on our macrophages, which are also called antigen presenting cell, like the macrophages, they are like the police of our body. So whenever there is an antigen that is presenting on the antigen presenting cell, I'm just giving you an example like how this develops, like these neoplastic proliferation, how this develops. So in like childhood you will get an infection, and when this antigen will present on your macrophages, these macrophages will present them on the helper T cells, the T lymphocytes, helper T cells, and these helper T cells will release cytokines, and these cytokines will activate B lymphocyte. So these lymphocytes, what are they gonna do is they will act on plasma cell, and these plasma cell will produce the antibodies, which are IgG, could be IgA, could be IgE, could be IgM, IgD. These are the type of antibodies that a plasma cell will produce in our blood. So these in the B lymphocytes. So this plasma cell, what happens in multiple myeloma is there will be a raised level of cytokines due to the infection. Sometimes these cytokines become more in number. They produce like increasingly in our body due to the infection that a person has been facing in the past. Due to those infections, these cytokines will start acting abnormally due to their increased production. So as a result of these increased production of these cytokines will act on B lymphocyte, and B lymphocyte will act on plasma cell, and in this way these cytokines will produce a neoplastic proliferation of these plasma cells, and that's how these plasma cells will get malignant, and they will produce the abnormal level of the proteins in our blood. So we will carry on with the pathogenesis from here, but let's just tell you about the sites where this multiple myeloma is mostly seen. There are like 4 sites from where this multiple myeloma can originate. Those 4 sites are respiratory mucosa, GIT mucosa, lymph node, as we know that the B lymphocytes are stored in those lymph nodes, and bone marrow. Where there will be the production of the osteogenesis. So these are the 4 sites where these antibodies are mostly formed, and the tumor, like the malignancy, will originate from these 4 sites. Mostly it's the bone marrow where it's originating. This is the most common one. So moving on with the multiple myeloma, let's just discuss the pathogenesis, like what really happens in this. first of all, what happens is these cytokines. What are those cytokines? Will be increase interleukin 6 plus interleukin 12. These are the two cytokines that will be raised, that will increasingly produced, and they will cause the neoplastic proliferation. So these, what they do is they will act on these plasma cells, and as a result there will be the development of neoplastic proliferation, because these cytokines are not acting normally now. They are working increasingly. They have an increased number of cytokines in the blood, so they're not acting normally. Their function would proliferate the neoplasms. So there will be neoplastic proliferation, and this neoplastic proliferation will produce a mass of malignant cells, a mass of malignant plasma cells, which is called plasma cytoma. It will produce a mass of malignant plasma cells, which will be produced as a result of the neoplastic proliferation of the plasma cells. So this plasma cytoma will further produce many symptoms. This will act due to these malignant plasma cells. When they will act on different organs in different sides of the body, when they will start depositing there, then they would start acting up in such a way and produce such symptoms. The other thing that the neoplastic proliferation would do is it's gonna produce abnormal antibodies in our blood, and that process is called paraproteinemia, as we discussed earlier. As we have already discussed, this paraproteinemia. So first of all, we will discuss the plasma cytoma. This plasma cytoma mostly affects the bones. That is why the patient will come to you with the bone pain. And remember one thing, that the patient will be above 70 years. It is a malignancy of old people. So always remember, the patient will come with the age of above 70. So there will be, when these malignant plasma cells they will act on the bones, and the most common bones that are affected in this case is the vertebral column. Vertebral column is the most common bone which are affected in multiple myeloma, and the chance is 66%. There is 66% incidence of vertebral column getting affected in case of multiple myeloma. Next, it can act on flat bones. It can act on flat bones like ribs. Let me just write it with the other one. Like ribs, clavicle, scapula, pelvis. These are like the flat bones, so they're more prone to multiple myeloma. and skull. These are the bones that get affected in this case. So what happens next is these are the bones that will be affected. We're not discussing the features. I'm just telling you that these are the bones that will get affected. We will come to the features due to this bony destruction later. Next, these plasmacytoma, after affecting bones, they will show up some features due to the bone marrow destruction. Of course, these antibodies, these plasma cell will produce antibodies in the bone marrow. Of course, there will be increased level of these abnormal level of these antibodies in the bone marrow, and they will start destroying the bone marrow as well. And this bone marrow destruction will show up the famous symptom which is known as, it is a famous symptom in almost all the bleeding disorders, and that is pancytopenia. And we know, I guess you know what is pancytopenia. It has got 3 symptoms, that is anemia, there will be bleeding, and there will be repeated infections. There will be repeated infections. So this was the bone marrow destruction. Now the next thing that it would do is bone destruction. As I told you that the most common site of destruction will be the bone. So the patient will come to you with bone pains. The patient will be above 70. Patient will be an old man that will come with bone pains because there will be raised level of calcium in the bones, because there is an abnormal increased level of antibodies in our bones as well. So there will be increased level of calcium in our blood, in our bones, and this hypercalcemia will produce certain features, which are, it can produce renal stone, like the calcium type of stones, and there will be abdominal pain, and there will be an increased level of calcium in the body. So whenever there is an increased level of calcium in the body, then of course there will be confusion and thirst. Of course it's gonna go, there will be raised level of this calcium will lead onto the brain, and that's gonna produce confusion and thirst. So next thing that the plasmacytoma will do is, it's gonna affect the vertebral column. As I said, the most common bone involved in multiple myeloma is vertebral column. So what it would do is, there will be, these plasmacytoma will produce a fracture in the vertebral column, and this fracture would lead to spinal cord compression, and this spinal cord compression would lead to spastic paraplegia. And spastic paraplegia is the weakness of both legs, of bilateral legs. Just listen it. So there will be spastic paraplegia plus urinary, I'll just write it here, I hope you got it, urinary incontinence. So when the vertebral column will get fractured, it will compress the spinal cord, and there will be spastic paraplegia, which is the weakness of both the legs, and plus there will be urinary incontinence due to the vertebral column spinal cord compression. So one more thing, this multiple myeloma due to this plasmacytoma can metastasize. There will be metastasis. There will be metastasis of this malignancy, and it can affect other organs like the liver and produce hepatomegaly. Spleen will be more affected. Splenomegaly, we will see splenomegaly, and there will be lymphadenopathy as well. The lymph node get affected as well. So these were the symptoms and all those, like the functions of plasmacytoma, like what it does and how it produces certain symptoms and how does it affect the organs. So this was it. The next thing that we discuss is the neoplastic proliferation will produce paraproteinemia. This paraproteinemia, let me just write it on the other page. So now the neoplastic proliferation, we were here, neoplastic proliferation will produce paraproteinemia in the blood. We were here on the last page. And this paraproteinemia is like the abnormal proteins in the blood, and this will produce IgG, and mostly 70% are IgG that are formed abnormally, and IgA is 30%. So what happens in multiple myeloma is there will be production of abnormal proteins, which is called paraproteinemia, and those abnormal proteins are mostly IgG and IgA. The incidence of IgG is 70% and IgA is 30%. So due to these proteins, what can happen is there will be repeated infections. These abnormal proteins will produce repeated infections, and when there will be, we know that there is 55% plasma in our blood, and when the plasma will get mixed with increased antibodies, increased plus abnormal antibodies, these plasma plus increased antibodies will produce sluggish or thick blood, and this is called as hyperviscosity syndrome. When the blood will become sluggish and thick due to the abnormal proteins addition in the plasma, it will produce hyperviscosity syndrome. It is a notorious syndrome in most of the bleeding disorders, which includes headache. There will be headache, blurred vision, faintness, and dizziness. Faintness and dizziness. Next, this was hyperviscosity syndrome. Next thing that these paraproteinemia can produce is they will start deposition of these antibodies, abnormal antibodies, in different body organs. And we know that this is called amyloidosis, the deposition of abnormal antibodies or proteins. Antibodies are actually proteins, so deposition of abnormal proteins in different body organs is called amyloidosis. And here we will have secondary amyloidosis, which is due to certain infections or malignancy. This is called secondary amyloidosis, and the organs that get affected are heart, brain, etc. So next thing that happens is these antibodies, they're in the plasma, they're in the blood, and of course they will be transferred, they will be transported to kidney for the filtration. It's transported to kidney, and when they will enter the kidney, they will enter renal tubules for filtration. They will enter renal tubules and produce and damage the damage tubules and produce ATN. So if you know what ATN is, it's acute tubular necrosis. When they will enter the renal tubules, because they need to get filtrated, all the blood comes to kidney for filtration. So when they will enter the renal tubules, they will damage the tubules and produce acute tubular necrosis, which is a type of acute renal failure. And when they will present in urine, their presence in urine will be confirmed by urine electrophoresis. That is a very specific test for the diagnosis of multiple myeloma. We will go and check for the proteins, these abnormal antibodies, and it will show the presence of abnormal proteins in urine, and these type of proteins are called Bence-Jones protein. It's a very notorious MCQ that comes to exams, almost all the exams. It's very important. They will ask you what type of proteins are found in urine in case of multiple myeloma. Then you will always answer that there is Bence-Jones protein. So this was it. Next we will just write down the clinical features. We have discussed earlier that there is 70 years old. Males are most affected. Males and females are both equally affected, and it is more common in the black people, in the blacks, like the Afro-Caribbean. And whenever there is like then whenever there is like a bleeding disorder, they will present with fever, malaise, anorexia, constitutional upsets will be there. These constitutional upsets will always be there. Weight loss. So we have already discussed that this multiple myeloma has great affinity. Always remember that it has great affinity for flat bones, like the clavicle and the ribs and all that. So there will be bone pain. That is the most typical presentation with multiple myeloma. So always remember that there will be an old man coming to you with bone pain. And yeah, that's all. So these are the kind of symptoms that the patient will come with. And yeah, for the investigations, how do we investigate multiple myeloma? We have a diagnostic criteria for it. This diagnostic criteria, it says that there should be, so number one is biopsy, bone marrow. This is the number one investigation. And diagnostic criteria number one is there should be malignant cells on bone marrow. Malignant cells or plasma cells, malignant plasma cells should be seen on bone marrow biopsy. That's criteria number one for the diagnosis of multiple myeloma. Criteria number two is there should be abnormal so next investigation we will do is serum or urine electrophoresis. And this will show abnormal immunoglobulins. So we will find out abnormal immunoglobulins on serum or urine electrophoresis. So this is the number two criteria for the investigation of for the diagnosis of multiple myeloma. The third criteria is evidence of end organ damage. There is evidence of end organ damage, and this evidence will come through when we will do CBC. We'll have low hemoglobin, there will be low calcium, there will be increased calcium. All of this implies end organ damage. Deranged LFTs, there will be RFTs, I beg your pardon, and there will be lytic lesions on X-ray. There will be lytic lesions on X-ray. These are the evidences for the end organ damage. There will be decreased level of hemoglobin, there will be increased level of calcium, the RFTs will be deranged due to the involvement of ATN, and there will be lytic lesions on X-ray. So this is it. That's all we have. from multiple myeloma, and we have certain electrolytes, this calcium, and there are other electrolytes. There are two types of electrolytes that can cause CNS abnormal functioning. One is calcium and the other one is sodium. So calcium, whenever there will be an increased level of calcium, then it's gonna produce like the symptoms related to the brain. There will be, yeah, so this is it. That's all from multiple myeloma. I hope you enjoyed the video and you learned a lot and you got the concepts. Make sure to subscribe my channel and like the video, and I'll be coming up with the other blood malignancies in my coming videos. And well, till then, I love you guys. Take care. See you.